So today we're gonna start a very another important topic, which is actually blood transfusion. So let's start it. Bismillahirrahmanirrahim. So basically, blood transfusion is very important for various type of reasons, and the only source is actually human donation, and this source is very scarce. Means the amount of this source is less, and when the blood is received, so it is separated into different components like packed red blood cells, fresh frozen plasma or platelets, and karyoprecipitate. Sometimes the coagulating factors are also separated and actually stored due to the deficiency of the factor 8 in hemophilics. The packed RBCs are the commonest blood products that actually uses, because this increases the oxygen supply to it increases the oxygen supply to various type of oxygens. If you transmit or transfuse 250 ml of packed cells, so basically it increases the hemoglobin 1 gram percent in adult. What are the indications that should be used when you are doing blood transfusion? When you give packed RBCs, it should be actually the patient should be either hemorrhagic shock, the patient should be under a major surgery like surgery of the heart, GIT, or extensive burns. This can also be treated to anemias that occur due to extensive burns and chronic blood loss that is occur in hemorrhoids, blood disorders, and chronic duodenal ulcers, etc. And also in inadequate production in malignancies or nutritional anemia. To replace the platelets, is important in thrombocytopenia, fresh frozen plasma in vitamin K deficiency, which is actually not so much responsive or responsive to vitamin K replacement as in liver diseases, or to reverse the effect of morphine. Karyoprecipitate, which is also replaced fibrinogen in patient with the disseminated intravascular coagulation. Okay, and the full blood is actually administered in a The whole blood is actually given in a trauma with a very heavy blood loss, and the rationale is being the patient rapidly loses all the components of blood, so you have to replace all the components. So basically this makes sense that whole administration of blood rather than their individual components. So okay, however, many blood banks are Many blood banks are not even they are reluctant, means not willing to allow whole blood transfusion. Guidelines when to transfuse actually very important. When blood loss is more than 20%, HB is less than 8 gram per dl, and HB of less than 10 gram per dl in patient with a major cardiovascular disease like you have ischemic heart disease. Okay, so basically हमारे पास ये है कि ब्लड प्रोडक्ट्स क्या है. ब्लड प्रोडक्ट्स में सबसे पहले हम रीड करते हैं पैक्टेड RBCs. when the whole blood is actually centrifuge, so what happened that the RBCs actually settle down and the platelets plasma remains supernatant, mean they come upward. So this plasma is actually transferred in another bag with preservative is added to red cells. Okay, then each bag consists of 250-300 with red cells concentration of 70%. These red cells are used when the HB is less than 7% in a chemotherapy patient, either major surgeries like GIT surgery, heart surgery, or delivery, trauma, grossly anemic patients, or infants, or especially with a patient with the sickle cell anemia, special sickle cell crisis. The higher transfusion threshold actually may be used with a patient with a cardiac disease, means a patient who has less than 10 you have with a cardiac disease. Each unit of bag cells should increase, which I have told you, HB by 1% and hemocrite by 3%. The red cells may be leukodepleted, means that the white blood cells are removed, means the red cells are separated by white blood cells for use in patients who have requiring multiple transfusion to prevent either antibodies to prevent the development of antibodies to leukocytes. So basically you will remove the white blood cells, or in those who are known to react to leukocytes in the past, or the patients who actually react to leukocytes in the past. Okay, And the rate of blood or blood product administration, this rate actually depends on the quantity, that how much quantity, and the speed at which the blood is lost from the body. Slow transfusion actually indicates that the patient is suffering from any cardiac disease or any renal dysfunction or having anemia, or pediatric patients like.